Welcome to our podcast, where we bring you insightful and engaging educational content. If you're a curious learner eager to explore new ideas and concepts, be sure to subscribe. Joining our community will provide you with free access to content that not only informs but also inspires action for a brighter future. Today, we're diving into the concept of health as human capital. You might wonder, what does this mean? Well, at its core, human capital is the collection of skills, knowledge, and experience possessed by an individual. But what about health? That's right, health is a crucial part of our human capital. It plays a vital role in our ability not only to earn income and be productive but also to enjoy life to the fullest. This is particularly significant in today's fast-paced world, where our well-being directly affects our performance and opportunities. Let's explore this fascinating relationship between health and economics further. First off, consider health from an economic perspective. Health holds considerable economic implications, both for individuals and society as a whole. Healthy individuals are more likely to work longer hours, earn higher wages, and seize more career opportunities. On a broader scale, when populations are healthier, they tend to be more productive, which leads to lower healthcare costs and stronger overall economic growth. We can measure the economic value of good health through numerous metrics: less absenteeism from work, increased productivity, and longer working lives, just to name a few. Something to keep in mind, though, is health disparities. These differences in health between various groups often lead to significant economic inequalities. By understanding the economics of health, we can see why governments often invest in public health initiatives and why companies are eager to offer health and wellness programs. It also highlights how we, as individuals, stand to gain by prioritizing our health. Now let's shift our focus to physical health and think about how it links directly to productivity. Think about it, your physical condition affects how much energy you have, how well you focus, and how many days you miss from work. Regarding productivity, healthy workers are more engaged and can deliver better results. Yet, did you know that chronic conditions like heart disease or diabetes can significantly diminish productivity? They can even lead to early retirement. Every dollar spent on workplace wellness programs returns up to $6 in terms of reduced healthcare costs and improved productivity. When you evaluate the connection between your health and your earning potential, it becomes clear: investing in exercise, proper nutrition, and preventive care is not just wise, it's essential. And let's not forget the importance of mental health as part of our human capital. Just as physical health contributes to our ability to work effectively, so does mental health. Emotional well-being, resilience, and the ability to manage stress are all fundamental aspects of who we are and how we function in the workplace. Mental health conditions, such as anxiety and depression, can greatly hinder productivity and expansion in your career. The staggering reality is that global costs associated with mental health issues run into hundreds of trillions each year in lost productivity. As a result, understanding and treating mental health issues should be regarded as an economic priority. Fostering a work environment that supports mental well-being can pay off with better performance and a healthier workforce. Next, let's discuss nutrition, an essential building block of human capital. Proper nutrition not only prevents chronic health issues but also supports brain development, especially during childhood. When kids eat healthy, they set the foundation for developing strong cognitive skills and making better decisions later on. Conversely, malnutrition can contribute to obesity, diabetes, and a wave of health issues that ultimately impede productivity and inflate healthcare costs. Research indicates that investments in childhood nutrition yield some of the highest returns, making food choices a crucial economic matter as much as a health one. Access to nutritious food is not just a personal concern, it's an economic opportunity. Transitioning to exercise, regular physical activity stands as a key investment in our health. Engaging in physical activity promotes cardiovascular health while also building endurance and reducing disease risks. When we remain active, we also lower our healthcare expenses and enjoy higher workplace productivity. The monetary benefits of being physically active are considerable. Lower costs are synonymous with fewer healthcare visits and reduced sick days. Additionally, consistent exercise plays a vital role in maintaining our ability to live independently as we age. The costs of physical inactivity, including a rise in chronic diseases, can ultimately result in a decline in overall quality of life. Gaining perspective here emphasizes the importance of treating exercise not just as a personal choice but as a collective investment in future productivity and happiness. Equally important is sleep, often overlooked yet crucial for maintaining our human capital. Sleep impacts our overall health, immune function, and physical recovery. It also plays a pivotal role in our cognitive functions, affecting our memories, learning, and decision-making abilities. A lack of sleep can lead to costly mistakes and decreased productivity. Alarmingly, sleep deprivation is already creating a significant economic burden globally, costing billions in lost productivity each year. Prioritizing quality sleep isn't merely self-care, it is a necessity for sustaining performance and health. Now, let us touch upon preventive care, which is fundamentally about investing in your health before issues arise. Regular checkups, screenings, vaccinations, and health education can catch problems before they become detrimental. Preventive care is often far less expensive than treatment and can lead to significantly reduced long-term healthcare costs. For example, early screenings for cancer can save lives and decrease treatment costs. Another example is vaccinations. They prevent widespread infections that can lead to costly healthcare scenarios. The return on investment for preventive services is astounding, with numerous studies indicating that the savings far exceed the costs associated with these early interventions. Understanding preventive care underscores the importance of proactive health measures as investments in long-term health and productivity. As we explore health further, it's essential to recognize that investing in health is a lifelong commitment. The choices made early in life, particularly concerning nutrition and healthcare in childhood, create a robust foundation for lifelong well-being. In our working years, maintaining health through exercise, nutrition, adequate sleep, and stress management preserves productivity and enhances our earning potential. As we advance into our later years, good health allows for a better quality of life, reduces healthcare costs, and extends independence. The notion of compounding returns on health investments is comparable to financial investments. Early and ongoing health choices yield greater benefits over time. In essence, living longer is great, however, living healthier longer, often referred to as health span, is even more crucial. By grasping the value of health as a lifelong investment, it's clear that the decisions we make today will resonate for decades, shaping economic opportunities and personal well-being. Ultimately, viewing health as an essential aspect of human capital emphasizes its significance in our lives. As we've learned, health is a valuable asset that leads to increased productivity and improved quality of life. Both physical and mental health play integral roles in shaping our economic trajectories. The components of nutrition, exercise, sleep, and preventive care are not mere checkboxes on a wellness list, they are critical investments in our futures. These health investments compound over time, reinforcing that our choices today matter deeply and have far-reaching ramifications. Investing in your health is among the highest returns you can achieve, affecting your earnings, happiness, and longevity positively. By framing health as a central aspect of both our economic and life planning, we can prioritize our welfare and resilience, ensuring we respond not just when crises arise but through continual awareness and proactive measures. In summary, today's discussion highlighted the significance of health as human capital. We explored how health contributes to individual productivity and broader economic outcomes. From the impact of physical well-being on work output to the economic advantages of mental health and the necessity of nutrition and exercise, we uncovered crucial insights. Understanding health as a lifelong investment reveals how proactive choices foster long-term benefits in our lives and society. Ultimately, recognizing health as an asset empowers us to prioritize our well-being and make informed choices that benefit our futures. Thank you for joining us on this educational journey exploring health as an essential part of human capital. If you found value in today's episode, don't forget to subscribe for more enriching content. Together, let's continue striving for knowledge that enriches our lives and futures. Until next time, take care of your health and keep investing in your well-being.